Greetings and welcome back. In this lecture, we're going to explore the intricacies of herbal medicine and come to a conclusion, or maybe not. Is it a healer or a hoax? In my clinical practice, I had a young adolescent who was really interested in weight loss. And she came to the clinic and told us she was using a popular herbal therapy at the time called Metabolife. And we warned her about some of the potential side effects, but she was going to use this product. Came in one morning not feeling very great, and we'd been monitoring blood pressure and things like that for her, but she came in one morning and didn't feel well. So the nurse practitioner took her blood pressure, and it was 240 over 120. Heart rate was 170 beats a minute, and we ended up transporting her to a local hospital to have her stomach pumped. And what was the problem? She'd been on this product with really no adversity, and now all of a sudden was having an adverse reaction. Well, the amount of active ingredient in the product that she had switched to, she had opened a new bottle that day, was 200% of what was declared on the label. So it wasn't necessarily the ephedra in that product, it was the amount of ephedra. So we've got a little bit of a conundrum here on how do we help to navigate this world of herbal therapies. Well, I want to start out by just mentioning that optimum nutrition, disease prevention, and wellness, which is sometimes called complementary care, are all concepts that resonate with many Americans. So my young adolescent was really trying to manage her weight issue and really wanted to manage it on her own and not rely on her physician. Because these concepts resonate with Americans, herbal therapies and integrative medicine, which is medicine that treats the whole person and his or her lifestyle, that encompasses the physical, psychological, and spiritual self, are increasing in popularity. And herbal therapy is oftentimes considered part of the complementary care movement. Interestingly, in the United States, we call herbal therapy oftentimes alternative medicine, where the rest of the world, where nuts and berries have been used as drugs for centuries, is considered actually traditional medicine. In my experience, individuals who are interested in complementary medicine are motivated and focused on the prevention and optimum management of disease. They are interested in protecting their health. But when we explore reasons for the use of herbal therapies here in the United States, they're varied, and they include some dissatisfaction with traditional medicine might be a reason, the need for a patient to take charge of their own health care. And how many of us do that on a regular basis? We want to be more involved. We want to know why a particular medication would be used. Is there a different medication with fewer side effects? There's also a belief that natural medicine is somehow safer than traditional medicines. And so that might drive someone to try an herbal therapy. Well, this lecture will explore the myths and realities of herbal medicine in the United States, with an emphasis on some of the few most popular supplements. Well, let's take a look at the prevalence of use in the United States. This was revealed in a study where David Eisenberg of Harvard and others compared the use of various types of complementary and alternative medicine in 1997 to their use in 2002. And what did this study show? It showed an increase in this time period of herbal therapy from about 12% to 18.6%. This represents actually around 38 million Americans who are using some form of herbal therapy. And who are those 38 million Americans? Well, the predictors of use include being female, an annual income of greater than $65,000 a year, and greater than a high school education. But it also includes the uninsured. Now, why would an uninsured person fall into that same predictor category? Well, oftentimes individuals who are under or uninsured are oftentimes first generation from a foreign country. So in my experience in Houston, many of my immigrant families are using what they consider to be traditional medicines that they bought in Mexico or Central or South America. So oftentimes they are using what they consider to be traditional, where the other predictors of use really tend to be individuals that might have been born and raised here in the United States. And the popularity of herbal supplements like what is hot is oftentimes media driven. So the list of the most popular herbal therapies shifts frequently. I can remember when everybody was using St. John's wort or everybody was using garlic. And again, it's almost the herbal therapy du jour, what is out there and what is popular. Well, what is different here? What is different about herbal therapy in the United States? And I think we need to set the stage by actually exploring the Dietary Supplement Health and Education Act. Well, in the early 1990s, the FDA decided to weigh in on a popular trend where there was an emerging interest in herbs as medicine. We were all familiar with using garlic as a seasoning agent, or maybe oregano or rosemary. But what happened in the shift in consciousness in the United States in the early 1990s, where now we're starting to look at them as drugs? So David Kessler, who is the commissioner of the FDA, said, wait a minute here, we're going to have to look at this. This is not a food use anymore. This is now a drug use. And during that period of time, he proposed a more active role for the FDA in the management of this emerging trend of herbs as medicine. Well, industry concern was growing and public campaigns began because the American population really didn't want the FDA weighing in on what they considered to be something that was in the food supply. Why would the FDA need to regulate that? I think a distinction has to be made at this point in time, though. What Kessler was saying at that point in time was he was not trying to label the garlic that you buy in the grocery store. But when the garlic was used in an amount that you would not normally get as a food, could it potentially have drug effects, and should the American consumer be informed? Well, you can imagine the flurry of legislation that was being crafted at that point in time. And what we had proposed was something called the Dietary Supplement Health and Education Act. And what this was designed to do was be a stopgap, that we really didn't want these herbs regulated as medications, but we didn't want no legislation at all. We wanted something in between. The authors of the original legislation included Tom Harkin, who's a Democrat from Iowa, and Orrin Hatch, a Republican from Utah. The significance of these political authors probably needs to be highlighted. Tom Harkin actually believed that his allergies were cured by using bee pollen, and he has been an advocate for health his whole time serving as a legislator. Orrin Hatch comes from the great state of Utah, and that is where most of the supplement companies are housed, or the manufacturing plants are in Utah. So I think they both had a vested interest on either end of the spectrum on why they wanted some legislation to serve as that middle ground. Well, what it ended up to be, it was David Kessler then against the supplement industry. Kessler was looking for something, and lo and behold, he got it. What we ended up having during this period of time is there were deaths associated with a contaminated amino acid, L-tryptophan, that caused deaths from taking this tainted supplement. Really wasn't the tryptophan, it was something that was in the tryptophan supplement. And so Kessler's saying, wait a minute, this is not an amino acid, this isn't a food anymore, we're labeling it different, we're putting it in a pill or a capsule, and lo and behold, he got some ammunition. During that period of time, there were supplements on the market, and I remember going into health food stores in Houston and seeing supplements that were claiming to cure HIV, driving individuals away from their primary health care provider to something in the health food store that was going to cure, which at that point in time was an incurable disease. So you can imagine the flurry of individuals trying to buy supplements to cure their HIV. So Kessler's weighing in on this and saying we've got a problem, there are some tainted supplements, there are some claims being made, and certainly during this period of time, opposition came from what was called the Nutritional Health Alliance and Gerald Kessler, no relation to David Kessler, Gerald Kessler, who hired celebrities to market the herbal industry in commercials. So Whoopi Goldberg was part of this, James Coburn, and Mel Gibson. And I remember seeing a commercial, and maybe you saw some of these as well, where Mel Gibson was standing in front of his food pantry with locks on it and saying what the FDA wanted to do was make all vitamins and minerals and all herbal supplements prescription only. And honestly, this was a fear-driven campaign. That's not what the FDA was looking to do. What they were looking to do was to, again, provide some safeguards for the American public. There was actually something called Blackout Friday in health food stores in 1993 saying, sign a petition. We need to inform the FDA we don't want our vitamins and minerals prescription only. Ultimately, David Kessler lost his battle against the industry, And in 1994, the Dietary Supplement Health and Education Act actually passed. This allowed supplements to be marketed as all natural, and Americans today embrace this concept. Now, what's the alternative here? Are we going to market them as all fake? Are we going to market them as synthetic? So almost anything that's labeled all natural on a product, American consumers are driven to this. So I've always joked that if I was marketing tobacco, I would put waving fields of all natural tobacco on a cigarette carton and I would call it an all natural product, and I could do that. You must be aware that there's no legal definition of all natural. There is of organic, but there's not all natural. Okay, so what did we end up getting with this concept of the Dietary Supplement Health and Education Act? What we end up with is something called a structure function claim. So a dietary supplement can say something about this food that contains calcium may promote bone health. So it can make a link between what the compound is and bone health, but it can't say calcium cures osteoporosis. So it can make a structure function claim. So another example would be a product could say may strengthen the immune system, but it cannot say will cure HIV. So this was what the intent was, but unfortunately the actuality is that we have significant loopholes. I have on my desk back in Houston ads in trade magazines that violate this over and over and over again. I have one ad that's in a very popular magazine on alternative healthcare that talks about taking a herbal medication to cure impotence, regardless of its cause, diabetes, heart disease, whatever. It cannot legally do that. But the challenge is there's not adequate numbers of inspectors within the FDA and the FTC that handles the false advertising to make sure that these advertisements are actually removed. So I call this quick kill nutrition, that a manufacturer can go in and violate DSHEA, as it's called, the Dietary Supplement Health and Education Act. They can violate it, but by the time they're caught, they've already made a lot of money and pulled out of the market. So unfortunately, what that means is that we can have dangerous or adulterated or falsely advertised products that reach the market. Concerns also exist for herbal medicines or raw ingredients that might come from China or other foreign countries, as concerns have been raised about the purity of the raw materials and whether or not some of the raw materials can actually be adulterated with prescription pharmaceuticals. So if I'm taking an all-natural herbal product, say for example valerian, that's marketed to calm me down, if this has been adulterated with Valium, I'm going to be really calm, but it's not going to be because of the valerian, it's going to be because of the Valium. So the United States, being relatively proactive to try and counter this, has opened up a testing facility in China to test the herbal medicines before they reach the United States market, or more importantly, before the raw ingredients reach the United States market. So what was the unintended consequence of this legislation? We know that it was allowed to make structure function, and it couldn't make a disease claim, but what was the unintended consequence of this legislation? What we have now is no pre-market approval. So in other words, a company does not have to prove that it's safe before it reaches the market. There doesn't have to be a safety study that's done. So think about this from a pharmaceutical standpoint. Would you want to take a prescription medication where the manufacturer didn't have to tell you the consequences, didn't have to prove that it was safe? You probably wouldn't want that product. But yet in the dietary supplement realm, you can actually buy products with no pre-market approval. The burden of safety has shifted, therefore, from the manufacturer. The manufacturer doesn't have to prove that it's safe. The FDA has to prove that it's unsafe. Now keep in mind, the FDA doesn't have any more regulators than it did before this legislation passed. So again, this is another concept of saying, yes, we've got legislation on the books, the FDA just needs to enforce it. All true. But if the FDA does not have any more inspectors and they can't do their job because now they're inundated, we've got the legislation, we just lack the enforcement. So contaminated products or products with too much of the active ingredient, like my poor girl taking Metabolife, or an undeclared substance can reach the market. Again, Metabolife is a great case example. We can argue that low dose ephedra is unbelievably effective as a weight loss aid. However, if products can have zero ephedra up to 200% of what's declared on the label, we don't have enough safety nets there to control that. Certainly, Star Caps as a weight loss pill, 6 professional football players within the last year, and we've discussed this in an earlier lecture. 6 NFL players ended up taking Star Caps as a weight loss aid, and it had an undeclared diuretic on the label. Certainly, FDA and Consumer Reports have also indicated that of the 61 popular weight loss pills on the market, 49 had an undeclared substance. So keep in mind that if you buy a weight loss product at the store, at the health food store that says all natural, that you may actually be taking a prescription pharmaceutical, and if you're drug tested, you may not want to have an adverse outcome with that. In the United States, and here's a key distinction, in the United States, removal of products or herbs from the market is rare. That is not true in other countries of the world. In other countries of the world, and I'll tell you from my opinion, Germany leads the world in this effort. They have removed products that don't work or are not safe or have adverse outcomes associated with it. So I think the challenge is other countries of the world that look at herbal therapy more as traditional medicine realize and respect that sometimes these medications may need to be removed from the market. And lo and behold, we've currently removed one from the market, and that's ephedra. Ephedra gained national attention when a pitcher came to training camp, and I will tell you he was overfat and not in great shape, and he was taking ephedra for weight loss. And what ended up happening is he took more and more of the product. He actually had a heat-related injury, and at the time of his death, his core body temperature was reported to be greater than 108 degrees. So the way I describe it is he cooked from the inside out. So ephedra was then removed from the market. The challenge is, was it the ephedra or was it the dose of the ephedra? Other high-profile individuals, and unfortunately this is oftentimes what it takes, is when a high-profile individual is injured, hurt, killed, maimed from a dietary supplement, that tends to get our attention. Kicker Van Seal was a 24-year-old swimmer from Kentucky, took a multivitamin contaminated with an anabolic steroid that was not declared on the label. So what happened to Kicker? Well, he was banned from swimming. He sued the supplement manufacturer in state court and was awarded over $578,000. But I will tell you what happens to athletes that are caught with a ding on their record. They're looked at as cheaters, and maybe they are. They're looked at as cheaters rather than saying, could this young man have possibly known that he was going to test positive for an anabolic steroid when he was taking a multivitamin? I can't look into his mind or into a crystal ball, but I would tell you he probably wouldn't have thought a multivitamin is going to cost me my swimming career. Another very popular example, and I still have athletes today that want to use this product called ZMA. This is a dietary supplement with research demonstrating it could significantly increase strength. There was one study demonstrating the effectiveness, and this came from the lab of Victor Conte, of the Balco lab scandal. Conte has been considered by some to be the mastermind in the surge in anabolic steroid use by slightly altering the steroid molecule. So we saw high-profile Olympians be stripped of their gold medals by being associated with the Balco scandal and some of the anabolic steroid use. So with ZMA, it was only his research that showed ZMA was going to significantly increase strength. Other research studies following his couldn't prove that it had any beneficial effect at all on strength. Now, what about popular supplements and current concerns? Well, this is where you might want to sit back in your easy chair and take out a pad and paper and take some notes. You know how things go. When we pull one compound off the market, like we did ephedra, we're looking for something to replace it with. And lo and behold, enter in bitter orange. Bitter orange chemically is ephedra's cousin. So the banning of ephedra increased the use of this product for weight loss. And again, I'm going to suggest to you, there is science to suggest that ephedra combined with caffeine does improve weight loss outcomes. So you can lose a little bit more weight when you partner these. Well, when ephedra was banned, jumped in bitter orange. Now, bitter orange, along with ephedra, can elevate your blood pressure, elevate your heart rate. So I think the challenge is that when one is replaced with another, you got to be a little bit careful. So in combination with caffeine, bitter orange is demonstrated to promote weight loss, and certainly that's going to be the manufacturer's claim. Drug interactions. Well, there are drug interactions with ephedra and other prescription medications. And unfortunately, because these are labeled as supplements, they don't have to declare this on the label. So there's a drug interaction if you happen to be taking an alpha or a beta blocker. There's going to be an interaction with ephedra. MAO inhibitors, interaction with ephedra. And again, where are you as the consumer going to be informed of these interactions, unless you're going to a pharmacist or you're seeing a registered dietitian on a regular basis? So what are the side effects? Well, certainly elevated heart rate and blood pressure. And truly, that's one of the reasons why ephedra and bitter orange help you to lose weight. They actually raise your metabolic rate, and in this case, it's evidenced by an increased heart rate. But what happens if you want to go to sleep at night? If I have an elevated heart rate, an elevated metabolic rate, elevated blood pressure, I may not be able to sleep at night. And certainly case reports exist of a stroke in an otherwise healthy 38-year-old male taking ephedra and taking some of these weight loss products. So again, you have to be a little bit careful. Was it the herb in there? Was it an adulterated pharmaceutical? Was this individual taking a pharmaceutical along with a prescription medication? And again, you've got to be a little bit of a nutrition detective before you're going to venture into this world. St. John's wort. The major use of this herb is for the management of mild to moderate depression. The problem is the results from major studies are inconclusive. Some say it works, some say it doesn't. Many of these studies indicate this herb might be effective for minor or mild depression. However, a major clinical trial for major depression concluded that St. John's wort is ineffective for significant depression. Now, I'm going to mention this more than once because I think it's a key point. In the countries of the world that get this right, if you have an illness or a condition that really does require a pharmaceutical, you would be discouraged from taking a less effective herbal medication. Now, the drug interactions with St. John's wort may be significant, and this is one of these herbs that you saw splashed all over the newspaper, and then all of a sudden it started to contract and lost a little bit of favor. It's because it interferes with many drugs. It can interfere with birth control pills. Now, that might be an unintended consequence that you weren't looking for. But if you've had something like a kidney transplant, any kind of organ transplant, and you are on lifelong immunosuppressive therapy, it will reduce the effectiveness of those drugs. It can interfere with warfarin, which is an anticoagulant. It can interfere with digoxin, which is used to treat some heart problems. And it can also cause mania in those with an underlying mood disorder. Now, keep in mind, when St. John's wort first came out, we had no warning of those side effects because there was no need for pre-market approval. So all of this was discovered in individuals just like you, just like me, that went out and took these and oops, all of a sudden had an adverse reaction. Now, what about echinacea? Echinacea is one of those herbs that is used to stimulate the immune system. Some studies suggest that echinacea is effective for the treatment of upper respiratory infections. And again, we're always going to find this some studies, not all studies. Some experts recommend against the use of echinacea for autoimmune disorders, such as lupus and TB. So why might that be the case? Well, if echinacea actually stimulates the immune system and you have an autoimmune disorder like lupus with an immune system that's out of kilter, you may not want something that's going to stimulate your immune system. As with most herbal therapies, it's a plant, so it's part of the aster family. Keep in mind that if you're highly allergic to a particular plant, if the herb you're going to take is in the same botanical family, this might be a contraindication. Those with significant asthma or allergies outside of this plant family should really probably avoid this preparation as well. Additionally, for those with an immunoglobulin E-mediated hypersensitivity, there is an increased risk of anaphylaxis or the ability to move air or you stop breathing. A study, however, evaluating the amount and the correct species in health food stores revealed very disappointing results. 10% of the products tested had absolutely no echinacea. 43% of the products tested met the standards listed on the label. So the claims of a standardization of an extract listed on an herbal therapy, and oftentimes you find that on the front of the label, are not insurance. Now I want you to think about this. If very few, or 10% of those herbal medications had no active ingredient, you've A, wasted your money, or B, you switch brands and you increase the dose and now you have an adverse reaction because you took too much of it. Also, within this family, possible interactions may also occur with immunosuppressive medications. Garlic, traditionally used to lower cholesterol, and it is a common prescription in Germany. So if your cholesterol is mildly elevated and you go to a German physician, he or she may try garlic first and then ramp it up if your cholesterol is not well controlled. A recent meta-analysis suggested that although garlic was more effective than placebo, the amount of cholesterol reduction was modest. So here's another example. If your total cholesterol is 400, garlic is not going to be effective enough for you to have significant cholesterol reduction. Garlic was also used as an antimicrobial agent during both world wars, and it's relatively effective. However, there is a significant risk of bleeding that exists if you use garlic with nonsteroidal anti-inflammatory drugs, things like aspirin, Aleve, Motrin, and other drugs that affect blood clotting, including other herbs such as ginkgo biloba. Well, what about aloe vera? Do you all have an aloe vera plant in your yard? I certainly do. It has been used topically for centuries to promote healthy skin, and it's effective for its use. Aloe juice can be taken orally. The latex form, the latex portion of the aloe plant, has a very strong laxative and can cause potassium depletion and kidney failure. So keep in mind, aloe latex is not the same thing as aloe vera. Aloe latex is often sold in foreign countries, and I've seen it available via street vendors in Mexico. In the United States, the FDA required reformulation in 2002 to remove the offending compounds. A small study suggested that oral aloe vera may be effective for treating ulcerative colitis that has a therapeutic effect as it's swallowed. But further research is needed to confirm this effect. Possible interactions may occur with some medications for diabetes, digoxin, and diuretics. An additional popular herb, ginkgo biloba, has been used as part of traditional Chinese medicine for centuries, and the leaves contain flavonoids and compounds that reduce blood clotting. Due to its anticoagulant effect, it should be avoided prior to surgery. Now think of the additive effect here. Ginkgo, garlic, and omega-3 fatty acids that we've discussed in the past all prevent blood clotting. They all have an effect. So you as a consumer need to be aware that if you're taking a combination of different kinds of vitamins, supplements, and herbs, you might have to discontinue those prior to surgery. Again, the part of the plant makes it either a benefit or a poison. Ginkgo biloba seeds can be fatal and have been associated with seizures in children. So where the plant leaves might be appropriate, the seeds are not. The effectiveness of ginkgo for intermittent claudication or leg pain or peripheral occlusive artery disease has demonstrated that it actually is effective for reducing pain, probably because it has an anti-inflammatory effect similar to aspirin. But there are possible interactions that might occur with this plant, including interactions with antihypertensive medications, blood sugar lowering medications, anticonvulsant and antidepressant medications. Now what about ginseng? Actually, there is more than one species that is being used for dietary supplements. It's been used medicinally for over 2,000 years. Ginseng may actually thin the blood and acts synergistically with other herbs and medicines, so another one that you want to avoid prior to surgery. It's often reported to be a tonic or aptogenic herb, indicating it's a multi-purpose herb. Siberian ginseng, that specific species, is linked with hypertension, but not the other ginseng species. Reported benefits for exercise performance, improvement in diabetes, again, are all going to be species specific. Controlling mood, cognitive and sexual function, studies on those functions, I've come back with mixed results. Some of the variability of these studies actually is because of the difference in the species. So again, not all ginseng species are going to act the same way. Certainly, as with other herbs, possible interactions may occur, and again, oftentimes you have those synergistic effects with other herbs that interfere with blood clotting. So blood thinning medications, medications used to treat heart disease, diabetes medication. So what's the prudent use? Tell your primary healthcare provider about the use of herbal therapies. Ask your pharmacist about interaction. And don't use for those conditions that require significant pharmacological action. So for cancer and heart disease, diabetes and hypertension. That's not the way these drugs are used in other countries. So if you have a need for significant pharmacotherapy, don't consider herbal therapies as your mainstay. Now, frequently asked question. I come from a country where herbs have been used as nutritional supplements for centuries. Why is the FDA so opposed to their use? In the United States, we do not traditionally remove herbal medicines when there's an adverse reaction. Other countries of the world do. They remove products such as Germany. The FDA is not opposed to their use, but would like more information on purity, safety, and efficacy to protect the American consumer. Are there any labels you should look for to determine if an herbal supplement is safe? Well, certainly there's an NSF, International Seal, a Consumer Lab seal, and Informed Choice. These seals are the consumer's best assurance that a product is not contaminated. I always suggest that those who are interested in purity, safety, and efficacy join Consumer Labs and get safety alerts delivered right to their desktop. Thank you very much.